A major UK population-based study has found that children face significantly higher health risks from COVID-19 infection than from vaccination, reinforcing the importance of continuing pediatric vaccination. Published in the Lancet Child Adolescent Health, the study examined health record of nearly 14 million individuals under 18 in England between January 2020 and December 2022. About 3.9 million children had documented COVID-19 infection, while 3.4 million aged 5-17 had received at least one dose of the Pfizer-BioNTech vaccine. Researchers compared short-term and long-term risks or rare but serious complications, such as myocarditis, pericarditis, venous and arterial clotting, thrombocytopenia, and systemic inflammatory diseases like MIS-C. In the first week after infection, the risk of systemic inflammatory conditions, including MIS-C, was almost 15 times higher than in uninfected children. Venous thromboembolism risk was nearly 5 times higher, thrombocytopenia more than 3 times higher, and cardiac inflammation around 3.5 times higher. Even arterial clotting risk was more than double. Although these risks reduced over time, several complications, especially venous clotting, low platelet counts, and heart inflammation remained significantly elevated for up to a year after infection. This suggests prolonged immune dysregulation and endothelial injury in children post-COVID. In contrast, vaccination showed only a small short-term rise in myocarditis and pericarditis, mainly within the first week after the dose. Importantly, these cases were mild, self-limiting, and resolved quickly with routine care. When researchers calculated absolute excess risk, they found that children were nearly 3 times more likely to develop cardiac inflammation after infection than after vaccination. Infection was also linked to a broader range of complications than vaccines. The vast scale of the study, covering 98% of England as population, allowed accurate identification of even rare events. Findings align with adult studies that show COVID-19 sharply increases inflammatory and clotting disorders. Limitations include possible underdiagnosis of early infections and the lack of data on repeat infections or multiple vaccine doses, but these do not undermine the overall conclusion. The study also observed decreasing severity of infection-related risks across later waves due to variant changes and rising immunity. Yet children who contracted COVID-19 still faced measurably higher risks than their uninfected peers. Overall, the evidence strongly supports pediatric COVID-19 vaccination as a safer option compared to infection.